when you're starting as a student. Like, I wish I would have known more about the non-traditional paths in pharmacy than I did, because seeing the value that pharmacists still brings, like, that hasn't changed despite the negativity towards the profession of pharmacy as a whole, especially in the media.
Welcome to the Physician Pharmacist Podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland, and I'm a licensed pharmacist and fourth-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist Company. As this podcast has grown, we've had the tremendous opportunity to broaden our scope and explore other non-traditional healthcare careers. Tune in to hear from our non-traditional experts serving at the frontier of medicine, technology, and innovation. Today, we have the pleasure of speaking with Dr. Sierra Richard, who is an investigational drug service clinical pharmacist and founder of Happy Pharm Life, LLC. She obtained her PharmD from the University of Missouri, Kansas City School of Pharmacy in 2019, after which she went on to complete a PGY1 pharmacy residency. While working as a clinical pharmacist, she launched Happy Pharm Life in 2018, which serves as a media hub for pharmacy and healthcare professionals looking to get more out of their careers. She has dedicated herself to raising awareness of pharmacy burnout through her blog and YouTube channel, which has now amassed over 14,000 dedicated subscribers. Hey, Dr. Richard, thank you so much for being on the show today.
Thank you for having me. I'm excited to be here.
I think we have a lot of really interesting things to talk about today. And so let's start back at the beginning. Can you tell us where you're from and, a little bit more about yourself?
So I'm originally from Southeast Missouri. I grew up in a town of 882 people, very rural area. And while I was in high school, there was a local pharmacy in town. And I took one of these quizzes that told me what my career should be when you grow up. It was like BuzzFeed for back in the day. It was all on paper. But mine came back as pharmacist. And my mother, love her dearly, took it upon herself to tell the local pharmacist that that was my results. And he was like, "Hey, we're looking for some summer help. Would you be interested?" And I was like, "Sure, why not? I'll check it out." And so I worked in this retail pharmacy over the summer, and I continued to do that a couple more summers in school, and decided I really liked pharmacy and just continued down that path.
Wow. So it sounds like it was kind of a no-brainer at that point. You followed the test that you had taken and that led you down pharmacy. And then you decided, okay, this is the profession I want to explore some more. So then when you went to pharmacy school, did you end up doing like a 2+4 program, or was it some kind of different alternative program?
So I did 2 years of undergrad at Arkansas State University. It just was a great choice for me when I was looking at schools. I actually played volleyball down there, and that was the first time it kind of piqued my interest, but with the intent that I knew I wanted to go into pharmacy school in like 2 years and do all of the prerequisites in undergrad and then move into pharmacy school. And so then I transferred after 2 years to UMKC, School of
Mhm.
Pharmacy in Columbia. So I was at a satellite campus.
Wow. And so that's really cool. You knew like for a fact that you were going to be a pharmacist. So you're like, forget about this, athletic career that I have here. I'm going to pursue pharmacy all the way.
Yep.
Yeah, I fortunately had that experience where I knew, riding the bench in high school that wasn't going to be my career. So anyways, so that's awesome. And at what point you're progressing through pharmacy school, when did you think about pursuing like a pharmacy residency? Did you always know that you wanted to be like in the clinical sphere, or like how did you differentiate between doing the, retail pharmacy experience, which is what you had previously?
Yeah, so working in retail pharmacy, that's what I thought I was going to do when I was in undergrad. And I had a amazing mentor, Dr. Onko from Arkansas State University. He had actually worked in a pharmacy school, and so he was my organic chemistry professor. And he was the first person who told me about clinical pharmacy. I had said, "Oh, my plans are to go into retail." And at that time, I thought I would go back to my hometown maybe and work there. And he was like, "I've worked with you a lot, and I just really think a clinical pharmacist role would be great for you. I think that you would get a little bit bored in retail, and there's nothing wrong with retail." But he just knew me. I was a very ambitious student, and he was like, "I think something a little bit different might be down your path." So he's like, "My one ask of you as you go into pharmacy school is to look into clinical pharmacy." And so I walked into orientation being like, "I don't know what a clinical pharmacist is or what that does or what that's different." I did some Googling, but that's about it. And I found some student organizations. So ACCP, which is the American College of Clinical Pharmacists. So I walked up to
Hmm.
their booth and I was like, "Tell me about this." And that was the first time I heard about residencies. was at orientation in pharmacy school.
Wow.
Yeah, so I didn't really know. I came from, again, a very small town, so clinical pharmacists, there aren't many in the area that I'm from. And that kind of started me down the path and looking into residency. So I went to some of these organizational meetings, and the more I looked into it, I realized I could specialize in pediatrics, which I loved working with kids. And from there, I was like, well, maybe I should get some experience in this. So I got a job as an intern at the Children's Hospital, and the rest was history. I had mentors there that were just like, here's your path, we're going down it. And that's just where I went.
Yeah, it's funny how important like having a strong mentor in your life has on the kind of impact and where you're going to go with your career. Like having someone to look up to and kind of lead you down that particular like pathway is so important. And it sounds like that was the similar experience that you had as well, like similar to myself. So I think that's really cool. And I think it's difficult for pharmacy students, especially. It's cool that you had that experience day one.
Hmm.
I think it's hard for a lot of pharmacy students to conceptualize what clinical pharmacy really entails, especially not until like they get later into their pharmacy training. So it's usually not until like your I guess IPI rotations over the summer where you get to actually see you rotate in a hospital and you get to see some of that behind the scenes stuff that happens. So do you have any recommendations, I guess, for individuals who are looking to get more involved in clinical pharmacy, or pharmacy students who are looking to pursue a residency track?
Yeah, so I'll take the first one. If you are a student and you're like, I'm not sure about clinical pharmacy, I don't know what that is, use your resources online. Myself and others have put videos on YouTube to use, which normally that's not the resource or the first place you go, but that's a good place to get your foot in the door so you can at least get an idea of what the job entails, what does the day-to-day look like. And then I think trying to find somebody that maybe you can shadow even before those, IPI rotations come about, because by the time you get that far, it's a little bit harder to switch courses. You can still absolutely do it, but it can be a little bit more difficult because you've maybe established a job in a community pharmacy, or you've established, the trajectory that you're going maybe in organizations. And so having to pivot part of the way through pharmacy school, which really is close to halfway for a lot of people, can be a little bit more challenging if you are wanting to switch to a residency path when you've done half of pharmacy school, not looking at that path. So that would be my recommendation there. As far as wanting to do a residency, if you know that early on, my biggest recommendation is to find a mentor, because that is critical in helping you. And that can be multiple mentors. It could be your advisor. I had mentors and my advisors for pharmacy organizations, as well as my advisor who was assigned to me, to pharmacists that I worked with. So there were a lot of people supporting me. I did not get a residency on my own. I will never think that. It was the help and support of the people who were near me, who were able to give me advice that I needed to hear. And those same people still give me advice that I feel like I need to hear sometimes. And that is just absolutely critical in getting a residency. And then my next recommendation for getting residency is you can't do everything. So pick a few things that you can do well. Like every student wants to do everything on the checklist and the rubric that they hear they're going to be evaluated on when it comes to getting interviews. But the reality is nobody is ever going to get every single checkbox on that. It's not designed to do that. So picking things that you enjoy and that you are going to learn and benefit from, I think, is the most critical thing in becoming a good residency candidate.
Of course. Yeah. And to add to that too, having the mentors along the way is so important, just because like a lot of people don't think about this, but you need letters of recommendation down the line.
Hmm.
And that's something that really creeps up on you, where you like kind of done all this research, you've done all like you've had the good grades, had the community involvement, but then you're sitting there at the end and you're thinking, oh no, now I have to go find letters of recommendation. So having those connections and establishing those relationships so much earlier goes so far when it comes to applying into that stuff. And so obviously you made it into residency. And what was that residency experience like for you?
Residency was challenging. Imagine that. It's not something that I think anybody's surprised by hearing. For me, it was difficult and challenging because I moved from the state of Missouri to Texas, and my husband actually stayed in Missouri. There were a few reasons for that, but it was just better career choice for him at the time to do that, knowing that residency for pharmacy was 1 year. And so we were apart, and I also did residency during the pandemic. And so the
Mhm.
second half of my year was definitely altered. And that posed a lot of unique challenges, but it also gave me a lot of opportunities for growth. And everybody kind of laughed at me because I always would say, sometimes sarcastically, like, oh, that's a great learning opportunity. Like anytime something crazy was happening, I'd be like, that's a great learning opportunity. And so I just viewed residency as a giant learning opportunity. Like everything was a learning opportunity. And that doesn't mean it wasn't hard. That doesn't mean there weren't days where I was like, what the heck am I doing? This is so challenging and this is not a necessity. But ultimately, I think it made me a better pharmacist and definitely has allowed me, I can say with full confidence, to make an impact on lives that I wouldn't have been able to make otherwise because I had the clinical knowledge and skills necessary to contribute to life saving medication therapy regimen changes for my patients.
Wow. And yeah, to add to that too, I think like if you aren't uncomfortable, then you're not testing your boundaries and you're not kind of growing your experience. And so I think that's really cool. And obviously, residency is designed for that exact purpose to kind of put you at the limit or the frontier of your clinical knowledge and test you so that when you do have that in your clinical practice, you will be ready and I guess like a veteran when it comes to that. So cool. And so you obviously progressed through residency, you got out and you survived residency. But at what point did you end up thinking about forming your own business? Now, this is kind of like taking things into left field where you kind of diverged from the traditional pathway where you just went into strictly clinical pharmacy and that was the path that you took the whole way. So in the show notes before too, you prefaced that you had also started this during pharmacy school. So what point did you kind of take on, both of these things?
So I originally started Happy Farm Life in 2018 and it wasn't a business. It was a YouTube channel because I was searching on YouTube for pharmacy content and there was like one or two people and all the videos were old. They were like over a year old. And I was like, nobody's talking about pharmacy. And that has definitely changed. I think the pandemic, there's a lot more people who are on social media and utilizing the platforms than they did at the time. There were only a couple people on Instagram at the time when I started as well. So there really weren't a lot of pharmacists creating content, especially geared towards students to learn about the profession. And so I kind of started as a way to one have a creative outlet because I enjoyed watching YouTube videos. So I was like, I can do this. I did not know what I was doing and I could not do it without a lot of help, but I figured it out eventually. And then in 2021, is when I developed an LLC and decided, I want to grow this. I really enjoyed doing it. But in order to continue to serve the community I wanted to, I needed to do some leveling up. I needed to update equipment. And there were things that I wanted to do that I just couldn't offer without making this a business, bringing in some income and kind of turning things around. And so I realized that that's the direction I wanted to go. And since then, I've been trying to figure out what it's like to be a business owner. The other parts of it were, I have student loans. Like maybe at some point, this could be something that can help with those things from a financial standpoint as well. But really, it was like, I want to serve, I want to improve this content that I'm making, and I needed some income to do that. So that's where the business plan really took off.
Yeah, it's funny too. Like we start a lot of these things with the ambition of having it, become passive income, but that's like such a fallacy, especially in the early stages where it takes so much work to get things off the ground, to build that momentum. And obviously you've been doing this for a few years now, so like you're finally at that point where things have like kind of taken traction. And
Mhm.
so, speaking on being a business owner and all the lessons you've learned, what is like maybe some of the, I guess, most rewarding things about having this particular business in this niche that you serve?
So in December, I launched my first course, and it was the Pharmacy Residency Application Accelerator. And the whole idea was I got so many questions over the past several years of doing this about how to fill out your residency applications. And as somebody who has reviewed residency applications, I saw so many mistakes that students were making on their application, and they were great applicants, but they were doing things that were hurting them, especially when it comes to like getting an interview. I knew what was going to be required, and I'm like, if this person had done this, this, and this, they would have probably gotten the interview, but they didn't because they were leaving stuff out of their CV, or they weren't writing a great letter of intent, or they didn't ask the right questions and got the wrong letter writers. And so when I look at all of those things that students were doing, I was like, I could prevent that from somebody else. And so I launched my course, and I had several students that have gone through it, and it's been the most rewarding experience because match day is later this week. So I don't know if they matched yet, but I've been getting the messages, hey, I got these interviews, or I had this many interviews, or they're telling me how things went after their interviews and how they're planning to rank. And it's just been really rewarding to like get to like pour all of that knowledge into these students and hopefully help them match. So I'm really hoping I'll get some good news from them on Wednesday.
Oh, that's so exciting. And it's funny too, because we're living like parallel lives in the sense like I offer like at medical school admissions. And so like when I get like a student reach back out and say, oh my gosh, like I made it into medical school, it's like an incredible experience. And it kind of makes even like the long days where like there's not a lot of traction, or like, you know, you have like a little hiccup or a challenge that you come across, it makes it all worth it down the line. I'm sure you would agree with that as well. So fingers
Oh,
crossed things
absolutely.
turn out well for all
Yes.
of your applicants and your students. And I'm really excited to see the results of that.
Yeah, me too. I feel like very invested in this journey with them now because I've worked so closely with them. So I'm very excited to see how it turns out.
Of course. And so I want to take this opportunity to transition our discussion to the pharmacy profession as a whole. I think what is kind of unique about your platform is that you aren't afraid to talk about some of the challenges that the profession is facing. And I specifically want to touch upon two of your most common or popular videos referring to the recent pharmacy walkouts, as well as why 80% of pharmacists are actually considering an alternative career path. So speaking on the walkouts, and not only, I guess, like, not only you don't only tackle, you know, the interesting history related to retail pharmacy, but you introduce like several concepts such as like declining reimbursements, technician shortages, and even like increasing performance expectations for pharmacists. So with all that in mind, can you expand upon some of these major issues that are kind of plaguing the pharmacy business as a whole?
Yeah, so I appreciate that you bring this up because when I created my platform, one of the things that I didn't want to do is sugarcoat what was happening. I wanted things to be real. And I think that is one of the benefits of social media. While some people are still afraid to do it, and there's still things that I can't post about or can't talk about due to whatever I'm doing in my job, especially where I'm in a heavily regulated area. A lot of what I do in my day to day as an investigational drug service pharmacist is confidential. So there are certain things I can't be transparent about, but the things I can are like the history of what got us to these walkout points and the impact that it not just has on pharmacists, but society as a whole when we look at the healthcare system and how integrated pharmacists are. And so you mentioned the points of like the technician shortages. So in recent years, we've seen less and less people want to become pharmacy technicians. I think there's a lot of different reasons for that. One is the stress that comes along with the job. It is not an easy job. And that kind of pairs with the low reimbursement or pay for those technicians. And so they are working in a very high risk area. They are taking care of patient lives just as a pharmacist is. And yes, the pharmacist is checking, but they are doing a lot of the work on the back end to get that medication to a pharmacist check. And oftentimes are getting paid the same or less than people who are working at like McDonald's. And there's not, again, nothing wrong with somebody working at McDonald's, but just when you look at the impact on patient lives and the risk associated with making an error in their job and the training that goes into becoming a pharmacy technician, a lot of times the pay just doesn't add up for those people to stay or be retained.
Hmm.
And so as a pharmacist, it becomes harder to do your job because I will always say that a pharmacist is only as good as the technician that they're working with. The technicians are the backbone of the pharmacy. If you do not have a good technician to work with, it is going to impact your ability to take care of patients. And I have been very fortunate in my career to work with some amazing pharmacy technicians. And so I know the value that they bring, but a lot of technicians don't feel like they're getting the pay that reflects that. And they're being cut because we also are seeing lower reimbursements for prescriptions. So a lot of pharmacies are not making any money when they're dispensing medications, which is absolutely mind blowing. Like sometimes they are having to pay insurance companies to dispense a medication. And you don't always know that up front. I don't want to get too deep in the weeds with pharmacy benefit managers, but they are the middleman between an insurance company and a pharmacy. And oftentimes they're the ones who are determining how much a pharmacy is getting paid. And they, unlike insurances or pharmacies, are widely unregulated. So insurance companies are regulated, but the pharmacies and the pharmacies are regulated, but the middlemen are not. And so they are able to kind of set their own pricing and do some things that are less than desirable as a pharmacist for our reimbursement. And so it makes it hard to pay staff for their services when you're actually losing money doing your job. And so that's made a lot of challenging environments for pharmacists, for sure.
Absolutely. And like kind of those two factors right there compound on each other and lead to higher and increased, I guess, like elevated expectations for the pharmacist working those shifts where, okay, we can't find a technician to help, cover. So now you're just going to run the pharmacy by yourself. And
Mm-hmm.
with that comes no breaks, no, anyone to offload the workflow that you're experiencing. And so I think a lot of pharmacists were definitely put under additional pressure, and it's been trending in, I think, the wrong direction with how kind of overburdened a lot of these pharmacists are. And, the more overburdened they are, the more mistakes, the more kind of challenges, the more of them will actually end up dropping out, as well as what we've seen with the technician field. And,
Mm-hmm.
kind of talking a little bit more about another factor that has contributed to massive burnout. It was probably the pandemic. And during this period, we saw like mass retirements, large increases in overall dissatisfaction in the profession. And I know pharmacy wasn't the only industry experiencing this, but why do you think like the profession of pharmacy was hit so bad in comparison to maybe others?
I think there's a variety of factors like any area. So, working in the pandemic myself, I was in the hospital side, but you go into an area where it's very uncertain and then you are getting changing regulations all the time. So, it is hard to keep up. So, one day this is the recommendation, the next day this is the recommendation. So, yes, as the science improved and we got more information, we were constantly changing. So, it became a very fast paced, rapid changing environment. Pharmacists were on the front lines, but many pharmacists and across the board, just in the media as well as in political spaces, weren't acknowledged as healthcare professionals. So there were many different media presentations where they talked about healthcare professionals and then pharmacists. And like basically we're saying like pharmacists weren't healthcare professionals, or saying other retail workers such as pharmacists, and weren't getting that recognition for being healthcare professionals. So that alone isn't going to make somebody walk out, but it is a little bit discouraging, especially given what pharmacists were doing, which I think was the biggest burden, which was this vaccine increase. So pharmacists gave millions of vaccines during this time, which really increased their workload while having a technician shortage and this rapid pace changing environment. You were also dealing with people trying to prescribe medications that weren't recommended, denying a lot of prescriptions, getting a lot of pushback and hate from that. And then we also just saw the public's viewpoints shift over healthcare workers. So you went from healthcare heroes to how dare you push this vaccine on me, which I'm unfortunately that was the reality in some pharmacies. And I mean, there were pharmacists, I've heard stories where they were spit on for by patients saying that like how dare you take the vaccine or recommend this vaccine at the pharmacy just because there was a sign sitting on the counter at the pharmacy about getting their COVID vaccine. And so I think a lot of those factors played into why more pharmacists were wanting to leave. It was just we already were having a stressful time as pharmacists, and then that pandemic just added to it, and it was kind of the straw that broke the camel's back, if you will.
For sure. Yeah, you're already like kind of dreading going into work because you have like long 12-hour shift and you're not going to have any staff to help you, and then now you have to supplement and do all these additional vaccines, and that's so time consuming. Like people don't understand how invasive that is to like the pharmacy workflow, like to go over there, pull up, draw up the syringe, administer the vaccine, do all the counseling that is required beforehand.
Hmm.
Especially when you're saying the guidelines are changing like every day, so it's hard to be up to date with all of that information. So yeah, I definitely understand why that was the case. And kind of circling back to the walkouts as a whole, the interesting thing, I think the realization we've had is that pharmacists are in this major position of leverage now where we have the opportunity to kind of advocate for changes because there is such a shortage of us. Now, of course, the challenge with any kind of healthcare professional taking a stand is the concerns of disrupting patient care. So I guess, this walkout method has been highly debated. So in your experience, like how effective is the walkout and how can we kind of mitigate like any disruptions to patient care?
So with these walkouts specifically, there was quite a bit of lead time prior to the walkout happening, where the group that was organizing this walkout actually notified the pharmacies that were going to be impacted, stating that this is the date that we are going to do this. Here's the request that we are asking in order to not do this. And the organizations that they were working with, unfortunately, didn't even reach out until like a day or two prior and really didn't offer any solutions. So that's why the pharmacist who decided to continue with the walkout did so. And I think, you know, people bring up the concern about taking care of patients, and I think that is very important. I am very patient care driven, um, and safety driven. I really enjoy medication safety. It's one of my passions. But I think the flip side of that is if we continue to work in the environment that we are harming patients. Patients are getting hurt because of the staffing levels in pharmacies. Patients are getting hurt because we are not following recommended practices for staffing pharmacies. And the walkouts are typically short term. They are notified ahead of time. There's opportunities to hire people to like travel or do temp positions to cover those. And we aren't going to be able to temporarily fix this if we don't have any solutions in place. So the whole thought process here is the walkouts can be difficult and they can have an impact on patient care. They also, the organization that was working on organizing this, they had a map of which pharmacies were not participating because they had adequate staffing levels. So a lot of them were like independent community pharmacies that patients could go to. And so some of these pharmacies actually would put, we're closed. Here are the other people who are available to you.
Interesting. Yeah, that's really interesting. And I think really smart in the sense that, they're not impacting patient care to a dramatic degree. And they're also still advocating for like their particular needs. And that's obviously hitting these like major companies or wherever, the individuals in their basically in their wallets there where they have
Hmm.
to go out and staff additional people. And I think, the sad part is that's probably the only way you can get a lot of people to listen.
Well, and I think the interesting thing about the walkouts is one of the companies in particular got a lot of bad publicity from this, and their stocks took a toll. So you could actually see the change in the market, which is going to have a bigger impact than having to do pull extra staffing or have a travel pharmacist come in to cover a shift. That is a larger impact that they have not recovered from even now to return to that pre walkout level. So seeing the impact that can happen from just the media attention that this got, I think it can be beneficial for pharmacists to do this if it's done correctly, which I think the group that was organizing this was very patient care focused, and they didn't want patient harm to come from going through with this walkout, but they also don't want to continue to put themselves at risk of harming patients just from going in and not having the proper staffing.
Of course. And yeah, it's really cool to see kind of the impact of these, interventions that they've done. But I think it's still a major problem with the like pharmacy profession as a whole is despite, the advancements that they've made, burnout is so high still at this point. And, I think obviously it's a symptom of all these systemic challenges that they've encountered and that we've discussed so far. So what ways can pharmacists better insulate themselves to burnout or to rekindle the spark that they had when they first started this career?
And this is a really great question. And I think the first thing that I always like to tell people is that unfortunately, about 80% of what causes burnout is determined by your workplace. And that doesn't mean that you can't do anything, but that does mean it limits the impact of you doing personal changes, which I always encourage personal changes. It's something that whenever I'm in a difficult staffing situation, which I have been recently, that you have to readjust and you have to figure out what's going to work. And sometimes that means taking a step back. So we were talking about being a business owner earlier. When I was experiencing extreme short staffing in my role, I did take a step back from my business, my side hustle, because I didn't have the bandwidth to do both and do both well and not experience severe burnout. And so, you know, part of it's knowing your boundaries. And for me, that was taking a step back when I needed to for a while. That didn't mean I didn't post at all, but it just meant I wasn't posting as frequently or doing the same type of videos that I was before. And then another piece of that is just always trying to make sure that you're evaluating where you're at. Because if you start down the path, but don't get to the end of the path, you're going to be a lot easier to get yourself out than if you're already at the end of your wit's end and trying to go and make progress back to where you were before. And so I am constantly evaluating kind of like, where am I at right now? If I'm feeling tired, is it just like I had a bad week, or is this like, have I had a bad 2 or 3 weeks and I need to reevaluate what I'm doing day to day? And so a lot of the recommendations for burnout are things just trying to be, the recommendations they make as a human. It's like best care for your body, right? Like eating well, exercising, you know, having, if you're somebody who thrives on having social connections, scheduling time to spend with friends or family outside of work, scheduling time to do things you love or enjoy. And that can be challenging as well, though, if you're doing these longer shifts. And so I work night shift, and sometimes like I didn't get a whole lot of that in. Sometimes it was a difficult week. Um, and so it's just trying to find a balance for you, and balance may not look as like even work and life always. I like to think of it as kind of a fluid thing. Like sometimes I'm in this really creative mode and I do more work for my business and outside of my day-to-day job. And then sometimes I'm feeling a little bit more drained. So that's the time where I'm spending more time relaxing. Maybe that's the time I hit extra workouts in the gym, and kind of just finding where you're at and learning more about yourself. What do you respond best to? So some people really like to run. I hate running. If you told me that to fix burnout that I should go run, I'm going to look at you like you have two heads, because that's not going to work for me. But I really like to do yoga and Pilates. And so those classes help me. And so trying to figure out what works for you and realizing that that also may change as you go through your career. And so things that worked for me as a resident, some of them still do work, but other times it's just not where I'm at in life right now. And so I've had to pivot and change.
Yeah, I think what you stress right there is the key to burnout is not necessarily like everyone's going to have their own little thing that, makes them tick, or the thing that like kind of brings them back to like their center locus and, the being relaxed and whatnot. But what the key I think that you said was the introspection to like being aware that, hey, I'm starting to fray at the edges here. I need to, pull myself out of this situation to kind of refocus and reorient myself and maybe take a step away and then go back in. And I think that's so important. And I think that's the hardest thing to do sometimes is when you're like in the grind, especially like in residency or something like that. It's very difficult to like kind of escape and do that. So being aware of that in the first place and kind of being like mentally conscious of it, I think goes really far. And so I think that's really good advice right there.
Yeah, the
And,
awareness
we
can be hard. That's the problem. The awareness can be hard.
And we've all these things we talked about, especially with like kind of the pharmacy perspective. It's kind of easy to see why pharmacy school admissions are the lowest they've ever been. But I don't want this to sound like a negative podcast about pharmacy, because I think there's so many great things that are still there's so many great outcomes that are going to come from this career. And so what advice do you have to future students as to why they should still consider a degree in pharmacy?
So I'm in a very non-traditional role as an investigational drug service pharmacist, and I think that's one thing that pharmacy students or people who are going into pharmacy don't realize is there's a lot more to pharmacy than just hospital or retail. That's where a lot of people first thing. Most of people think retail. Some people don't even realize pharmacists are in hospitals. But if they do, they're thinking, well, I'm going to go residency track and I'm going to work in a hospital, or I'm going to, go right out of school and go into a retail pharmacy. And there's a lot of other opportunities out there. There are a lot of things that you can do with a PharmD outside of those traditional roles. The other thing is, no matter what, patients still are going to need the care that pharmacists provide. And if that is something you're still passionate about, you can find a path that's going to work for you. I will say it may be a little bit more challenging than it was, say, 10 years ago when I was, first looking in pharmacy schools. Everybody was getting sign-on bonuses and it wasn't as stressful of an environment. There were a lot more independent pharmacies available that had a little bit better, hours. So it may be a little bit more challenging, but I think having the right expectations of knowing that it may be a little bit more challenging of a career path than it used to be, but that there are opportunities, and to look at the non-traditional roles as well when you're starting as a student. Like, I wish I would have known more about the non-traditional paths in pharmacy when I was a student than I did, because I'm learning a lot about them now from doing social media and connecting with pharmacists who are in these non-traditional roles. But seeing the value that pharmacists still brings, like, that hasn't changed despite the negativity towards the profession of pharmacy as a whole, especially in the media.
Absolutely. Yeah, I still like advocate for individuals to go into pharmacy, but I think like the scope, like what you're saying, needs to change in the sense that you need to make sure when you go into it that you are aware of all these different opportunities down the line. And it doesn't have to be, like you said, just community pharmacy or just clinical hospital-based pharmacy. And so, kind of talking about this massive shift we've had in the recent years where things are tending to get a lot more clinical, like more clinically focused with how we kind of provide patient care. How do you think that's going to impact pharmacy as a whole, and where do you think it will ultimately take the profession?
So I was reading an interesting article the other day talking about the drug pipeline. Since that's part of my job at Investigational Drug Service, I work in clinical trials research. And so much of the drug pipeline right now are biologics, which are injectable medications that require a lot of counseling, and cell and gene-based therapies. And so the future of medicine is becoming more personalized. It is becoming more complex because our science has gotten to the point that we can cure diseases with gene therapy, or at least give somebody the appearance of a cure as much as you can, because you're not technically cured, but we're giving you a medication that makes it to where you're not symptomatic for diseases such as spinal muscular atrophy that used to kill patients. I mean, um, I get very nerded out with Zolgensma. It's my favorite drug, but it's a medication for spinal muscular atrophy. These patients didn't live to the age of 2 before. And now these kids that were in the original clinical trials are 8 years old and they are walking, talking, and have full motor function when they wouldn't have made it to that age at all prior. So the research we're doing right now is incredible and is life changing. And pharmacists are a huge part of that. Getting the therapies prepared, they're much more complex preparations than our normal IV therapies even are. And the counseling that goes into it, the pharmacists are the perfect people to be involved. They're involved with the genetic testing and determining which of these therapies might be best for a patient. And so you have pharmacists that are in the genetic side of things. We have pharmacogenomics going on. And so seeing how much information we have that pharmacists are going to be one of the most knowledgeable people in is where you see pharmacy going. And so I think the future of the pharmacy profession is really going to gear more towards the clinical side of things, because that's just where the pathway for medicine in general is headed.
Absolutely. And I love that you brought up Zolgemza too. That's something that's also kind of near and dear to my heart. I also nerded out about it. Do you mind just sharing real quick, like a quick fact about it? I know it's like a viral oncogene, like we basically like are inserting DNA into an individual's genome.
Mhm.
So do you have any like, quick drug facts for someone to take away from as an educational lesson?
Well, you asked the right question, because I could talk for a long time about Zolgensma. So basically, it's a viral vector based gene therapy. So they take an adenovirus, basically clean out all the inside of the virus, and put the DNA strand in. And it replaces the missing gene that patients have with spinal muscular atrophy that causes their muscles to not properly function. And This is a one-time injection. It is IV therapy. And so there's pre-medications and post-medication. There's steroids. There are risks with it. Liver toxicity is one of the top ones that you have to watch out a lot for these patients. However, just one single injection in these patients have a life expectancy that we don't even know what the result is. I mean, it could be a normal life expectancy. We're still in the very early stages because the patients who got this were infants when they were infused, because the earlier you get it in, the better. So as long as you're not premature, they don't want to give it to premature neonates, but at term, they will give the one-time injection. And in theory, they shouldn't have very many symptoms. We are seeing some therapy where they're going to give Zolgensma and Spinraza, which is the other medication that was already on the market, just to see, there's some testing going on to see, is Spinraza necessary? Does it help? Does it hurt?
Hmm.
But it's also very expensive. And so it's $2.1 million a dose. But looking at how much it would cost a patient to get Spinraza, and all of the care that associates with the fact that even with getting the Spinraza, which was the medication that was standard of care prior, you would still see progression of disease, and we don't see that now. And so with the lack of progression of disease, you could easily hit the $2.1 million much earlier with Spinraza, because you are ventilator dependent, you're having a lot more infections and hospital admissions than you would if you are taking Zolgensma.
Of course, not to mention the, patient mortality and morbidity
Absolutely.
associated with that.
Yep.
Awesome. Well, yeah, it's very, very interesting. It's a drug I came across and I'd done a presentation on too. So I was like, oh, wow, like that's so funny that you brought it up. But anyway, so we're getting to the end of our interview right now. And I think it's time for our famous 3 questions. And these are the famous 3 questions that I ask every single individual who's come on this podcast. And so question number 1, and we actually touched on this already a little bit, so maybe you could give us some broad, brush strokes of what you do exactly, but how do you maintain a work-life balance or work-life harmony, as you've said, in your daily life? And what recommendations do you have for others who are trying to achieve that same balance?
So I am somebody who likes to try new things. So that's one thing that I am always doing, is like, if something's not working, I'm going to try something else. And so my recent thing is I have joined a hot workout studio. So it has like hot yoga, hot Pilates, hot cycle classes. And so you're in like a heated sauna and doing the classes. And so it's been really enjoyable. And one of the other ways that I have been maintaining more burnout prevention, is what I like to call it, recently with my increase in workload, is I started reading again. So I filled my bookshelf behind me here, for those who are watching on the video, with books that just make me happy and things that I enjoy. So I carve out time before I go to bed each night to make sure that I'm doing that one thing that I like. So I have busy days like today. I worked all day, came home, had a few chores to do, and then I'm on this podcast. I'm also a member of a American Society of Health System Pharmacist, and so I have a meeting with them right after we're recording this. And so I know, though, by the end of the day, that I have that time carved out for something that I love and enjoy, and something to look forward to each day. So I think for me, it's like having something to look forward to right now.
Of course, I love that. And so question number 2, do you have any last minute recommendations to students or graduates who are interested in pursuing a career similar to your own?
I would say my biggest recommendation, I've already said it, but I'm going to say it again, is find mentors in the areas that you're interested in. And I'm going to add to that by saying, if there's nobody in your area that is doing what you're interested in doing, and you find somebody online, reach out to them. And don't be afraid to get some rejections on them helping you. So I've had students reach out, and it just wasn't a time that I could commit to at that moment because of my own personal life. It was nothing against them. I try to help whenever I can, but that's not always possible. So reach out to somebody else. If that person's not available, find somebody else. That doesn't mean that nobody is going to help you. It just means that maybe it wasn't a good time for that person to be that mentor for you. And you can also ask, since you're not available, is there somebody else that you might be able to direct me to who could help answer my questions? And I have frequently sent somebody to another pharmacist, or if they've asked me and I'm like, you know what? I know what you're wanting, and I'm not going to be the one to give that to you, but this is another person I can connect you with that I think can help you more. And so just starting those conversations online with pharmacists, whether that's LinkedIn or Instagram, or finding somebody's email and just sending them an email. I am more than happy to talk with students when I am available to do so. And I know many other pharmacists are as well. We don't put ourselves on these platforms to talk into a void. We want people to talk back to us. So don't be afraid to reach out.
Yeah, I think that's great advice too. And to kind of add to it in the sense that, like you said, when someone says no, that doesn't mean it's no forever. That just might mean a
Hmm.
no, upfront, or like, oh, this isn't the right time, like you specified. So don't be afraid to reach out to them. Give it some time, of course. Don't spam their inbox, but,
Yeah.
reach out a year or two from now or whatever time period is, appropriate, and say, like, hey, just I really wanted to connect with you. I really think you have a lot of it, insight into this process and so on. So that's happened to me multiple times where, I reached out to someone that said, I'm too busy. I can't, accommodate you in my schedule, but, reach out to me in 3 months, 6 months, and, maybe we can set something up. And of course it's back on you there, but, follow up with those particular leads because they ended up being some of the best connections I've had.
Absolutely.
All righty. And so our final question for the day, what are your personal, professional, or business oriented goals that you'd like to accomplish in the next 5 to 10 years?
Oh, you're asking the good questions. So I'll go with the business one since I don't talk about that nearly as often. I enjoyed working with students so much that I would absolutely love to do this in a higher capacity that I am doing now. I really envision this going somewhere where I can do a little bit more one on one mentoring with students and do more coaching through the residency process because I feel like the way things are set up in pharmacy, just mentoring, is you get a lot of pieces of the puzzle, but you don't get the puzzle put together for you. And as a student, it can be hard to put those pieces together because you may be missing a few and you don't realize it. And so it's actually on my whiteboard. You can't see it, and I'm not going to show it off, but I have a vision for the path that I would like students to go down where I put those puzzle pieces together for them and help walk them through the pharmacy process. And so I would love to see this vision that's over here on my board come to life where I can take students from pre-pharmacy or beginning of pharmacy school and walk them through the path to get a residency and be successful through residency and into their first job.
Wow. Well, I'm really excited to see that come to fruition in hopefully the coming months, maybe years, who knows?
Yeah, I have some plans in
Excellent.
the next couple months, so that just to starting down the path.
Just a little teaser then.
Yes.
All righty. So we've come to the end of our interview today, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey or pharmacy school journey, check out my website at www.physicianpharmacist.com. Before we let you go, how can our listeners get in touch with you and learn more about you?
So my YouTube channel is where my primary posting is. So Happy Farm Life over on YouTube. Instagram, I'm also posting a lot of content on there. The best place to find me and message me is in the DMs on Instagram, also at Happy Farm Life. And then if you want to check out some of these things that I am teasing, you can head over to my website, happyfarmlife.com.
All righty, Dr. Richard. Thank you so much for your time today. I really appreciate having you on the show. And I think we had really awesome discussions about the profession of pharmacy.
Thank you so much for having me. I had a great time.
All righty. Take care.